welcome to another episode of AirSculpt TV. Today we're going to talk with our patient who actually had regular liposuction 2 times before on her tummy, and on this show we fixed it, and her picture's right there, and we're going to post all this. But it's a great example of a lot of people have had body contouring from other doctors, other types of technology, other procedures. They're not happy, and then their journey afterwards and how AirSculpt can help them. She's so happy that we're going to go to Seattle with Dr. Bullis, and she's now having her inner thighs done. So we're going to watch a little bit of that, and we'll have a chance to interview her. If anyone has any questions for her, please write them in. But we've gotten some questions already, and we're looking forward to talking to her about her experience. So without further ado, let's go to Seattle. Hi, Karen.
Hi.
Thank you so much for doing this with us, not once, but twice now. So.
Oh, yes, I know. Happy to be here.
I'm looking at your before and after pictures from your previous AirSculpt. Now, you had regular liposuction 2 times before.
Yeah.
And guys, that's the black and white picture behind me. That's her befores. And then this picture that I'm pointing out with my thumb is her right before AirSculpt. I love your result after AirSculpt. So what I want to ask you for our audience here is, since you've had liposuction twice, then you had AirSculpt, tell us the difference. Obviously, the result is a million times better. I mean, what do you think about your result?
Oh, the results are absolutely amazing. It's so much better. I mean, my waist looks snatched. I feel better, and I'm awake during this procedure, which is absolutely great. I can see everything that Dr. Rollins is doing, and the fat's coming out, and I just love it because I think the results are absolutely 100% superior than previous.
And what about the downtime and the swelling and everything you went through after lipo compared to this?
Well, after the traditional lipo, it was 6 to 12 weeks recovery with AirSculpt. Oh, and it was also painful previously. With AirSculpt, it was just 2 weeks. I was back to working out, and like 3 weeks, I was back to playing tennis, and then even played in a tennis tournament. I think I played in 2 tournaments.
I love that. Okay.
It was my last procedure.
And wait, and when could you, or when did you go start working again after your procedure?
Oh, just the next day.
Perfect.
Yeah.
So that's amazing news. And I imagine after liposuction, you wouldn't have went to work the next day.
No, I think I took several weeks off, took some vacation time.
Yeah.
But no, I don't need to take any time off. I mean, after this one, I will relax tomorrow, but I'll do, start working again the following
Vacation time is for vacationing and not for recovering from surgery.
Yeah.
You know what I'm saying? Yeah.
Yeah.
Use that vacation time wisely, guys.
Right.
So you're decided to have your inner thighs done. Have you had them done before?
No.
Oh,
No,
that's great. So what you're going to notice, Karen, is that what you had before on your stomach, it's as hard as AirSculpt gets. Your inner thighs are going to be way easy, heal much faster, be much less swollen, much less painful. When you have scar tissue from previous liposuction, it actually makes AirSculpt harder, more difficult to heal, and it limits what we can do. Even though we achieved something, Dr. Bullis knocked it out of the park here. I mean, Dr. Bullis, you did a wonderful, wonderful job. It's just spectacular. Yeah. But your inner thighs are going to be even easier. So you're going to actually have a better experience this time.
Oh, so, yeah. So far, it's great.
So you're having your inner thigh AirSculpted right now. How much does it hurt?
Oh, it doesn't hurt at all. It just kind of tickles a little bit. It's just like coming to the spa.
I love that. Can we see what's going on? Can you pan over to what's going on with the AirSculpt so people can see?
Yeah, so she's getting her whole inner thigh and knee done. So we're kind of doing this whole inside. We've already got rid of that
so smooth. I love it. So let's just watch Dr. Bullis go. Dr. Bullis, any commentary?
Pardon?
Any
Yeah,
commentary?
so we've done the left leg already. The right leg is maybe about half done. How much do we have?
Okay.
Yeah, so I'm about half done. I'm going to get a little bit more. I'm going to have her. Let's have you straighten out your leg. I always like to look at how this folds. This is what everyone hates right here. Get rid
Right.
of it.
I call that the crotch pocket. Yeah.
Yep. So we're going to get rid of that, and I like to do that with the legs straight, really.
Yeah, me too. Perfect. And everyone, this is all going on in Bellevue, Washington. It's in Seattle. So
Go Hawks.
in Seattle, and they're all laughing in Seattle. So, and let's take a look at the fat. Can we pan to the fat? I want to see how much. Oh my goodness, Karen. Karen, you're bringing the goods. Wow. And I want everyone to notice, wait, go back to the fat. How much blood is in that fat?
Like,
How much blood?
maybe.
Not even 50%.
Hardly anything. That's
That's
mostly
pure
just water.
cheese. I love it. It's amazing. So that is like, I mean, and that's why AirSculpt is by far the best technology that exists. Like, no one else can do this. So that is incredible, just beautiful. And you can see there's no blood in the tube or anything. So, and that means less bruising in general. That means quicker healing. It means we're not hurting her and her underlying structures. We're literally just taking out fat. So pretty cool. So Dr. Bullis, how much did you get out of her first leg?
I think just about 200 cc's. So, you know, not a tremendous amount, but I think it's going to keep her with a really nice natural taper. I see some people get overdone, and then it looks like they have elephant legs. And
Yeah, for everyone, I totally agree with that. For everyone watching, inner thighs are probably the hardest area to body contour because if you do too much, you actually can ruin them very, very easily. So it's a tightrope walk to do perfect inner thighs. The skin is very thin, and you need to leave a little bit of fat so that the legs look natural and smooth and normal, and they're not lumpy, bumpy. So it's actually the hardest area that I train our surgeons to do, and it's the hardest area to do in body contouring, period. So, Karen, obviously, you're in excellent hands. So, and what kind of music are you listening to? I ask everyone.
Oh, Billie Eilish.
Okay, I like her. Nice.
Yeah.
I like that. What's your favorite Billie Eilish song?
Oh, what's that? Oh, I forgot the name. It's like One Light. You know the one
yeah,
light.
we just heard it.
Yeah, we just heard it.
Okay. I like the one that's like Bad Man or Bad Boy or something.
Oh yeah,
Bad
that's
Guy.
right. Yeah,
You
I
like that one too?
Yeah.
Yeah. So that's all we have for you. What do you want to tell our Instagram audience here, based on you've had 2 previous lipos, then you had AirSculpt. You're having AirSculpt of your inner thighs now. For people that are thinking about having this done, what advice would you give them now that you've been through it all?
I would say absolutely do it. I mean, particularly like a person, ethnic person, or person of color like myself, African American, we actually naturally carry extra weight in our hip size and buttocks. And all the diet and the exercise is not going to get rid of the stubborn fat areas.
Mm-hmm.
And I want to tell the audience, you don't need to just spend the hours in the gym anymore. Just stop doing that. It's not going to come out. Just make a consultation with AirSculpt and have AirSculpt solve your problem.
Thank you. I love that. And then what about to the question that we get asked all the time, is AirSculpt anything like liposuction?
No, it's nothing like liposuction. With liposuction, I'd either be under a light anesthesia or general anesthesia, and I'm awake now. There's no needles, no scalpels, no stitches. I can talk to Dr. Bullis and the staff here the entire time, and I can watch the fat come out.
And how do AirSculpt results compare to liposuction results?
Oh, they're absolutely 110% better.
Thank you. That's what we work hard to let people interested in AirSculpt understand. So I really appreciate that coming from you as one of our return patients. So we really appreciate that, Karen. Thank you.